I think that that's such a kind of powerful illustration, and I think it really underlines a lot of what Saul has been saying all day, which is that if you give young carers the opportunity to tell their story, there's no arguing against supporting them and supporting the people that they're caring for. And those two needs for support are so intimately linked that we almost can't have those conversations separately. And that's a lot of what I want to talk about today. When I was trying to put together the symposium, I thought about stories like this, media portrayals like this, but I also thought about the sort of culture of support and the relatively high recognition of caregivers. It seems to me, as somebody that's moved to the province, that there is in Quebec. There's a real volonté to act. There's a real will to act on this and a recognition of the need for it. So I want to talk about where we're at in Quebec and what we can build off of as we move forward. I want to start with a really important fact that there are kind of two kinds of care that we need to consider. There are people like Alexis in the video that recognize their role because of its intensity. And these are often people that are also have this role thrust upon them when a parent falls ill or a sibling falls ill, and they're connected to support because they're caregiving in that way. But there's also carers that don't recognize their role. I'm one of those people. When I got this job and started talking about young carers, it was a couple months into the process, and I was writing out a PowerPoint slide of the definition, and I had to stop and think and go, am I meeting the definition of a young caregiver? Like, how is it that I'm spending all of these hours a week looking at this issue and I still am failing to recognize that I'm one of the people that I'm trying to help too? A lot of young carers, when you ask them, when did this start? They just say, I've always done it. Or they say, I help my family, I'm not a caregiver. There's sort of a rejection of that label. It's why we call them young carers, maybe in some attempt to kind of distance that one directional sense of the word, for us to allow a little bit more space where they just care about their family. And sometimes that infringes on their own well-being. So I think that that's a really important thing that we have to start with. And it's important because it changes the way that we have to talk about this, the way we have to market our services, where we have to house our services, and how we approach public awareness raising, avoiding those pitfalls where we're actually ostracizing the people that we most need to reach. I think that when I left off, when I started the presentation, we were going to talk about contact points. It's something that already from the responses that you've shared from the workshop came up again and again, is where are the points of connection between the young carer, their family, the healthcare system, education system, the environment that they're in really, and what are the linkages between the organizations that can potentially help them. So the way that I think about this is really with contact points. At each one of these contact points, we can do something. So we talked a bit about a lack of self-identification, the fact that a lot of young carers don't recognize themselves. And that kind of complicates this first and probably most important contact point, which is ideally the young carer is coming forward themselves and asking for help. Everybody should feel empowered to do that, right? And the importance of the health and social services and of the youth environment is there because we're not quite there yet. We don't have that critical mass of public awareness and a lack of stigma where youth feel able to self-identify and to come forward and get help. And so there's a kind of tendency, though, to then advocate for doing it all, that every single one of these spaces needs to cover all of the bases for every young carer, and that really is impossible. So I want to put you at ease a little bit. I'm not going to tell you a just huge slate of what you have to do. I want us to try and work together today to look at what can I best do, what's beyond my ability to do, and who can I partner with to cover that gap. So I've listed them just as health and social services. I want to break that out into, you have the young carers care team. So their GP, their counselor, their school nurse, the health professionals and social professionals that work directly with the youth, those people need to be able to identify them and then refer them to services or offer them services themselves. That's different than the other care team that's involved, which is the GP or the physiotherapist or the therapists, the psychologists of the person receiving care. We need it to be possible that when somebody goes into a doctor's office, that doctor looks at that person and then looks at their family, asks, do you have children? Asks, do you have a spouse? Do you have a partner? Do you have a really close friend that sometimes helps you with these things? And then is able to then identify that young carer in those cases. I think it's really important to show that there's kind of these two modalities that we need to consider. And then finally, I have the youth environment. We've heard how important schools are, how important education is. And I'd like to point out too, the community sector is so important, and it is the majority of the people that have joined us today for this symposium. And I also really believe that the community and the community sector is where a majority of this care has to happen, because they're the closest to them. A lot of community organizations are really focused on offering care that's relevant to their very particular community or a very particular need. And those people have the sensitivity and the established trust with these families to be able to offer the care that we need and the support that's done in such a way that it doesn't put them off or ostracize them or make them actually feel less heard. So we need to recognize, guide, and directly support young carers. And we each have a role to play. And this approach would really make sense. It's pretty simple. There's just 3 steps, right? Like, we should be able to do this together. But that is only really true if we're talking about a very small group with extraordinary needs. And I don't think that that's what we're dealing with here. Somehow, there's actually quite a mass of young carers in our society that are invisible. This 1.25 million, not counting anyone under 15 and not counting anyone in the territories, is a staggering number. And it's too many. And so we need to ask ourselves why that is. Because what I just said about community organizations being the right place, they can't take on 1.25 million. They can't take on 10% of all youth in Canada. So we need to talk about prevention, about fixing the access to healthcare and social services and the basic resources that are necessary for health. That's what's going to have the biggest impact for young carers, and especially the young carers that are doing the most extreme forms of care. Really, young carers are kind of a symptom of a system that isn't working properly. These youth are putting themselves in these spaces that somehow we're failing to meet needs. There's a quote from a researcher on young carers from British Columbia, Charles Grant, and he says, "Being a young carer isn't living in a dysfunctional family. It's living in a normal family that struggles with exceptional circumstances." And I would agree. I think that care is natural, and a certain level of youth helping their family is essential, because society is about interdependence. But I would add to Dr. Charles' thoughts by saying, being a young carer is often about living in a dysfunctional health and social policy environment. So the best thing that you can do is to support policies that protect our most vulnerable people and support the inclusion and equity of marginalized groups. Because no amount of support groups or therapy or respite care can make up for the fact that your parent lives in legislated poverty, or they are denied care specifically because they identify they spend so many hours a week caregiving. There's this conundrum where suddenly, because you have the capacity to care for them, you don't qualify for home care, things like that. And so we need to ensure that basic level of well-being and dignity for people with disabilities, for people with different health challenges, because it is also restoring that basic level of well-being and dignity to those young carers. So our picture becomes a little bit more complicated. We can have this sort of continuum where governments obviously need to recognize and to help us have the resources to support young carers, but I think their main role really is in that prevention piece. I think that we could take off a quarter of these young carers that are doing these tasks because as a society, we choose that we want to live in a system that doesn't allow people to fall through the cracks like that. I think that we can do that, and the government is really the only place that can help us to do that. That can't start from the bottom up. Healthcare takes a huge role, obviously, because of those different modalities and those different ways it needs to be involved. But I think that their main part is in recognition. I really believe that if we were able to, when a person receives healthcare, if we just ask, are you receiving everything that you need? Or are you leaving my office with me knowing full well, oh man, I wish that I could offer them this. I don't know what they're gonna do when they graduate high school and they lose all of their supports as a young person with disabilities. Who's gonna pick up the slack then? If you have questions like that, then that is the point where you need to be identifying caregivers and young caregivers along with them. I think that that's the main role for healthcare, and then having a very clear line of where to guide them, where to get that support. I think education is almost the base, right? It almost covers this whole bottom part of this graph, its sphere of influence, because it has to cross from prevention to recognition to guidance and support. But I don't think that they need to be alone in that. I think that most of education's role is going to be in partnership with these other spheres, in partnership with government. Maybe we need policies to be able to identify young carers as they enter our school systems or as they move on to higher education. Maybe there needs to be dedicated supports for them to be able to be best equipped to do that. That's a partnership. Healthcare being integrated into education, having a line of trust where you can go to your teacher and there's communication with a hospital social worker or with a nurse or with your GP. Hopefully you have one. And finally, I have the community circle. I tried to make it as small as I could because community organizations are small but mighty. And again, I really think that they're going to be the basis where you have that trust, you have that connection, and you're able to serve really finely tuned needs moving forward. So what can we actually do? I think that we need, like Professor Becker was saying, outcomes-based supports. We need to consider what exactly a service that we're offering is doing. In your folders, I included a table that outlines these things, the preventative, mitigative, assistive responses. We need to look at avoiding the entrenchment of the role. That's what I call prevention. We need to reduce the care responsibilities that the young person takes on through mitigation. And we can assist them in coping with their role. And all the while, there's an approach that's been developed through young caregivers advocacy that's called the whole family approach. It's really looking at caring responsibilities on the whole family, bringing them together and talking about it and negotiating who can do what. Is this an equitable share? Is it a sustainable share of the care that needs to happen? And are there any outside supports that could take up some of those things? I won't spend a terrible amount of time on each one, but I just want to highlight a top one for each. What I'd like you to do is to really take that list and look at it and think about what your organization wants to do and identify one of these things. I'd also really love for us to map together what's being done, what isn't being done yet. There's a resource list in your packet that is missing a lot of your services. So please write to me and share what you're doing. Maybe relate it to some of this or share how you're going to be bridging into this sort of model too. With prevention, again, it's just about covering the basic needs of people receiving care. I think that's easy. That's an easy priority to set. That's a good solid action that we can do. And I think it takes advantage of young carers' tendency to be advocates and to be involved and want to make change. They can be real allies in securing those supports. For mitigation, I really want to highlight that in Quebec, we have this amazing project, Projet des Sans Fil. Young caregivers in the context of mental health are being taken care of. They're being guided. There's professionals across the province in each region that are taking them and informing them of their role, equipping them with resources, offering support, or developing supports as we speak. But one thing that is missing in Canada and in Quebec is training to mitigate the actual physical risk on the carer and on the care recipient. There's a program in the United States, or started there and now international, called Y-Care, and it pairs professionals with young carers and offers them training to show them how to properly administer medication, how to properly do a lift, or find resources that will help you to do that in your home if physically it is too risky for you to do that. That's something that I think is priority number one. It really weighs on my mind that we have nothing like this. Finally, we have assistive supports. And I think that this is where we're doing the most action. We have support groups. We have integrated them into our kind of larger network of caregiving organizations and told young people that if they need help, they can seek peer support. I think that there's such good work being done and there's so many good models already, which brings me to our existing services. Again, we can look at our strengths because a lot of these projects have been based on youth input or on treating people receiving care as experts. The Projet des Sans Filtres, which I'm a part of, is a project that is for youth and with youth as the leaders provincially, and the people that are hired to work with these young carers are all under 30 as well. I think that's so important to have it be peer-based so that it resonates, so they can speak sometimes the same language. So I'm returning to our contact points to say there are things that we can take advantage of. There are approaches in healthcare that are youth health initiatives, health promotion initiatives like Air Ouverte, where it's an integrated service model. They're targeting the more vulnerable or hard to reach youth and giving them a no wrong door, one-stop shop to get everything that they need. And it really speaks to their experience. It's a tailored service just for them. That's a great place to have young carers' information and support available in partnership. Equally, there's Access Open Minds, which integrates this real whole person picture of health. Similar sort of model where it's integrated care, but it's really fixated on that cultural element and really speaking to people from where they are and making sure that it's appropriate for the community that they're in. We also have the person that they care for's team. To me, maybe I'm biased because AMI-Quebec has such amazing family peer support workers, but all I can say is young carers, when asked what would help you navigating the healthcare system, they say, I wish I just had one person that would guide me, that would accompany me, and was able to shepherd me through this whole process. And I described in a study what family peer support was, and the young carers were amazed. They had never heard of it. It was people from across Canada. And I just can't underline enough how important this resource is. It's somebody that's a point of contact with the family and dedicated just to the family. And if they're integrated into that larger healthcare team, they can make a huge difference. But they need that buy-in from the healthcare system. They need to be there in the waiting room when the young carer arrives. Or they need to be passed on contact info if a caregiver asks for more information from a GP or from a psychologist. In schools, again, the Projet des Sans Filtres, a lot of the agents are focused on collaborations with schools. If there's a takeaway today, please, in your region, find out who your agent or your agent is in the Projet des Sans Filtres they should be your first point of contact. They are there literally to help build these bridges and connect these different people and be able to refer people to the services they need. In schools too, we have a really exciting pilot that's happened with the Regroupement des aidants et aidantes naturelles de Montréal. They've started surveying, they have gone into some CEGEPs and into secondary schools and designed resources, brought up this awareness, and then identified champions in each school that are the go-to person for young carers so that they're able to access support. And then, like I said, it's the caregiving organizations. There's so many organizations in Quebec that can just modify what they're already doing or just be more inclusive of an age bracket. And you have young caregiver support. To start, it doesn't have to be more complicated than that. So what's next? What are the priorities? I want to go through these one by one, and you've all identified a lot of them already. For me, a first priority has to be intersectionality. We talked a little bit about diversity and different understandings of care, different responsibilities of care, depending on where you come from and what your family believes. And I think that an asset-based approach to this, an approach that looks at what are our strengths and how do we move forward, an asset-based approach would start with diversity, start with intersectionality, and go from there. Start hyper-specific and start looking at the distinct experiences and the skills that these different communities bring to the table. We have a lot to learn from them. So talking about localized issues of discrimination, inequities, and structural problems, that might get people into the door that are experiencing these gaps in healthcare to then talk about young caregiving. But we also need to look at how these communities have mutual aid practices, integrated models of well-being, stories that explain interdependence, and cultural traditions of care that make their communities stronger when crisis hits. And I think that this really serves the need where young carers often feel like all they do is care for another person. They don't have the time and the resources to develop that identity outside of this role. And so strengthening culturally grounded community building activities as a part of their care just makes sense. Today really was all about leveraging the existing services, collaborating, making sure that people know that they can't do this alone and they're not alone in the work. We've been surveying people to get our resource list put together. It is impossible to draw a beautiful, simple map of where the services are in Quebec. It's really hard, but with buy-in from everyone, sending what your service is, what do you hope to offer, what types of people are you reaching, we can start to build that map together, and then we can map where the gaps are and work together to fill them. And we can also learn then from best practices. The other priority is youth leadership. We need the types of initiatives that young carers are capable of imagining and actualizing. These are determined and mature and empathetic youth that have an incredible skill set. They have basically nurses training, they have mental health training. These are incredibly skilled young people. And I share Professor Baker's wish that we would hire these youth because of their caregiving experience. So I'd like to tell you all to try and prioritize these voices, not because I think you should or because they need the opportunity, but because you can't afford to not have them at the table. And I haven't talked a lot about awareness, and it's because this is your awareness piece. Awareness should happen when young carers are empowered to tell their own stories, when we have young carers talking about how can we design a curriculum that tells schools about interdependence and care in families and caring about our society, what being a good citizen is, in addition to being a good family member. When we have them drafting our frameworks for community building, when we have them making artwork that explores what care means. And likewise, I haven't talked about research as much, and part of it is because I think it's being done well in Quebec, if I can say that. A lot of it is focused on centering those youth voices through photo voice, through surveying, and including them as council members to advise on those studies. For us, this piece at AMI means that we'll be launching a youth advisory council in the new year and working in such a way that we can integrate it with a national youth advisory council being established through Young Caregivers Association and integrating it as a really big part of our work with the Canadian Centre for Caregiving Excellence and their Young Carers Roundtable. The last piece is policy. I have to circle back to it. Young caring has a place in every social justice movement and is a frontier where Quebec can use its strengths too. I think that the sentiment of solidarity and our will to have a healthy and vibrant culture here will serve us well. I think that we can move forward together in partnership in Quebec and make us a leader in this. Again, I want to do a reminder of the Canadian Centre for Caregiving Excellence's Young Carers Roundtable. This is a national level body that unites all of these voices. You can learn from people from across the country, what they're offering, how you can integrate it into what you're doing, and how we can work together to really put pressure on there being policies that recognize and support young carers. I want to end it there because I really want us to move into our panel and into the other discussions. But I just urge you to not let this be the end of your participation. I hope that today you go home and you reflect on what's been discussed and you think about your place in all of this. And I hope that when I send the materials, the studies that Professor Becker mentioned, the slides from all of these presentations, some follow-up action calls, I hope that I get an enthusiastic response from all of you. Time check. 40. Okay, yeah, we'll close it there, but I hope that we can have some conversations as the day moves on. Thank you.